A nebulizer is a machine that turns liquid medicine into a mist. This makes asthma medicine easy to breathe in. Before using the nebulizer, wash your hands well with soap and water. Now, connect one end of the tubing to the nebulizer cup. Attach the other end of the tubing to the nebulizer. Then, pour the right dose of medicine into the nebulizer cup. Hold it upright so none spills. Attach the mouthpiece or mask to the nebulizer cup. This will help your child breathe in the mist slowly. Turn the machine on and check that mist is coming out of the mouthpiece or mask. If you're using a mouthpiece, place it in your child's mouth between the teeth. Your child's lips should close tightly around the mouthpiece. You or your child can hold it there. If you're using a mask, place the mask over your child's nose and mouth. You or your child can hold it there, or it can be strapped on. Your child just needs to sit still and breathe normally. It can help to read a book or watch TV. Getting all of the medicine can take about 5 to 10 minutes. Every so often, tap the side of the nebulizer cup to make sure all of the medicine is becoming a mist. When the treatment is done, the nebulizer will make a sputtering sound. Now, turn off the machine. Follow the cleaning instructions that came with your nebulizer.